Welcome to the Listen Up podcast, where we explore hearing loss, communication, connections, and health.
Hi, everybody. Dr. Mark Sims here. I'm the host of the Listen Up podcast, where I feature top leaders in healthcare. This episode is brought to you by Listen Up Hearing Centers. I help patients to effectively treat their hearing loss so that they can connect better with their friends and family and remain independent. The reason I'm so passionate about helping patients with hearing loss is because I lost my brother Robbie twice. First to his hearing loss from radiation to his brain tumor, and then when he passed away. I only care for ears. I'm the E of ENT. I performed over 10,000 ear surgeries in my career and taken many more with hearing loss and tinnitus. I'm the founder of Listen Up Hearing Center. I'm also the author of a book, Listen Up, A Physician's Guide to Effectively Treating Your Hearing Loss. If you want to learn more, go to www.listenuphearing.com, and there's a lot of information about the book and our services. Today, I'm excited. I have Dr. Edmund Farrar. He is a medical doctor who's experienced tinnitus himself in his mid-20s. It was during his time as a doctor in the military that he realized how extensive of a problem this is. And because of that, what he did was he with the goal of helping people with tinnitus, he co-founded Oto Health, a UK-based startup that is improving access to therapy for people with tinnitus and hearing loss using a simple mobile app, Oto. And so it's really interesting, and we're going to talk about that more today. Ed, welcome to the show. Thanks for coming on.
Thank you very much, Mark, for having me, and thank you for the introduction as well. Looking forward to an interesting discussion about tinnitus and ears.
Yeah, so I started, talking a little bit about your origin story, but give us your version of, how, I was looking at, I think some of your publications, you were in the surgical field, I think, but I'm not sure. But tell me a little bit about your medical history and how you ended up in as an app developer. Not that that's what you are. But.
Yeah. So let's get stuck in. So I'm a medical doctor by background. I graduated medical school in 2015 and immediately joined the Royal Air Force. The plan for me originally was to train as a surgeon in the military. I actually wanted to be a plastic surgeon. And during my time as a doctor in the military, two things happened. The first thing was I actually developed tinnitus myself. I'm sure your users will know and understand what tinnitus is. Thankfully for me, it was mild. I got used to it quite quickly. It stopped me from sleeping from time to time, but I was very, very lucky in that it didn't actually have too much of an impact on my life. So I didn't think too much of it at the time. The second thing that happened was I actually started seeing men and women with quite severe tinnitus as a result of noise exposure from their occupation, whether it was in the military, yeah. So pilots, people working without engines, weapons firing, that kind of thing, explosions. And it struck me how big of an impact tinnitus can actually have on your quality of life. Sure. And in many cases, tinnitus was actually completely destroying these people's lives. And if I thought back to my time at medical school, I don't know what it's like in the States, but here in the UK, we learned very little about tinnitus. Perhaps, I think like in the whole 5 years I've spent at medical school, we spent maybe 1 or 2 hours learning about tinnitus, not about tinnitus itself, but as a symptom of something perhaps more sinister. You need to check if someone comes to you presenting with tinnitus, you need to check they've not got a brain tumor or something like that.
Or aspirin overdose, right? Aspirin-induced tinnitus.
Exactly. Yeah, of course, that kind of thing. I thought that this is. I remember specifically speaking to this one poor chap who had really, really struggling with tinnitus, and I thought this is crazy. That firstly, there's no cure for such a condition that has such a big impact. But secondly, it's actually very difficult to access any kind of help. So got me thinking. I got together with my co-founder George, who's a doctor in the Navy, very similar background to me, and he'd had similar personal experience with tinnitus. His was slightly worse than mine actually, and we thought, let's do something about this. Let's create a digital solution for tinnitus that can be scaled to anyone with a mobile phone, and that's how Oto was born. We launched. We started thinking about it around 2 years ago. And sort of started getting our heads together and working how we could build this product. Very shortly after we met Jamil. So Dr. Jamil Muzaffar is an ENT surgeon here in the UK, very experienced in tinnitus and hearing research, and he provided sort of the clinical the clinical and academic oversight over what we do. And that's I suppose the origin story of how Oto was born.
Sure. So tell me a little bit about, so I know it's an app. I downloaded it. I started doing it, masking sounds and talks about different stuff and has a very pleasant British accented lady who takes you through parts of it. Lil, is that her name?
Lily, yeah, Lily.
And so anyway, for the, one of the things is for the non-medical listeners, tinnitus or tinnitus, it can be pronounced either way. I tell people it's like Caribbean or Caribbean, is a sound in your ear or brain that does not exist externally. That's kind of the clinical definition. But tell me a little bit talk about the different parts of the app and what are the things, the user experience, or what are the goals of the app, if you would.
So it's so many of your listeners will be familiar with an app called Headspace. It's like Headspace, but instead of teaching you to meditate, it teaches you to manage your tinnitus.
To attenuate, right?
Yeah, habituate, exactly. So the aim of the app is something called habituation. And we can talk in a bit more detail about what habituation is and how it works.
Sure, that'd be good for the listeners.
So habituation is the process by which your brain stops perceiving tinnitus as a threat. And the sort of what that relates to in terms of your experience is that you no longer find it unpleasant and you stop noticing it. Let me use a metaphor to sort of explain how that works. If you imagine being on a long flight, the first 10-15 minutes of the flight, when the aircraft's taking off, you'll hear the engines and they're pretty loud. It's not a pleasant sound either. After 10 or 15 minutes, your brain actually tunes that sound out and you stop noticing the sound of the aircraft engines. You can even sleep and read and do other things without noticing this loud sound. And that's exactly what happens with tinnitus, and that process is habituation. You stop perceiving your tinnitus as a threat. The sound of the tinnitus no longer becomes unpleasant, and you stop noticing it almost altogether. If you do notice it again, it's not a bad thing. It's not like you don't get that negative reaction that you first had. It's been proven that the best way to habituate in a shorter space of time as possible is with something called cognitive behavioral therapy, CBT. CBT has been proven in multiple studies to be the best way to manage tinnitus. So the science says it's kind of the gold standard treatment. And we've taken the tools and techniques from CBT, we've taken CBT and we've packaged it into a audio delivered program that you access through our app. So 5 to 10 minutes per day, you listen to an audio session, which is a recorded voice, Lily's voice, taking you through an exercise or teaching you a technique. And you work your way through a series of progressive modules that teach you these skills that you need to habituate and basically just to stop noticing your tinnitus and stop having your tinnitus being intrusive in your life.
So how many modules are there, just at a
there's I don't know the exact number, but we have a core program, and there are 5 modules. There's 5 modules there, but we're always adding new content. And once you finish the core program, you can go and do different specific modules. So something on CBT, something on mindfulness. We've got a lot of sleep content in there as well. So you're not going to run out of content, basically.
Okay, great. And so just as a quick thing for any listeners, I think it's a great app for people to check out. How would they do that?
Well, there's a few ways, actually. The easiest way is to search Oto in the Apple App Store or the Google Play Store. So it's spelled OTO. It's like the name, but with 1 T. And you can download it and you can actually try it for free for 7 days. We have a 7-day free trial. And you've got 7 days basically to decide whether it's something you feel will be beneficial for you.
So you've had people use this. Do most people find benefit in 7 days? Because that would be very hopeful.
Yeah, we've had over 40,000 downloads. We've helped thousands of people so far with their tinnitus and have helped thousands of people habituate to their tinnitus. And the feedback we've had has been overwhelmingly positive. If you just look at the reviews on the App Store, We've had some awesome testimonials, and we get messages every day from our users saying, thank you, this app has changed my life.
That's great. That's great. And so, just as a sampling, so what are a couple of the modules that you're talking about? Like, so I know one, I started looking at the sleep module, but there are other ones too. Can you talk a little bit about those?
Of course, yeah. The core therapy, sort of the core program, essentially combines a number of different techniques, primarily cognitive behavioral therapy, but also sort of more specific, something called ACT, acceptance and commitment therapy, which is kind of like a sub part of CBT. So in this core program, you'll work your way through as I said, you work your way through the modules, and these modules will incorporate techniques from cognitive behavioral therapy, CBT, ACT, relaxation therapy, targeted mindfulness, some sound therapy as well, teach you how to use sounds to distract yourself from the tinnitus. And the idea being that the first sort of 4 to 6 weeks you're using the app, you're understanding how tinnitus habituation works and how tinnitus management works, and also exploring a number of different techniques that we'll provide to you and take you through, without having to sort of, we don't want people sort of working out and choosing something very specifically. We just want to provide it to them, and then they can decide what works for them and what doesn't. So that's kind of
they're field testing it themselves, in other words.
Exactly, yeah.
And figuring out what gives them the best benefit, right?
Exactly, yeah. So tinnitus is such a personal experience, and it affects people in many different ways, and what works for some people won't work for others. So we do encourage our users, we encourage everyone actually with tinnitus to experiment with things. And the app is such a good way to do that, because it just has everything in one place and will take you through everything. Physical therapy as well, some physio, neck stretches, jaw stretches, that kind of thing. We really hope that the app is all this content in one place. It takes the sort of the decision making out of the process for people.
So is there any recommendation of what people should perhaps do before using the app? I mean, is there a recommendation to get, one of the downsides, for instance, is if you don't have well-treated hearing loss, it's more likely than not that you might not get as good a benefit from tinnitus treatment until you rehabilitate your hearing loss, for instance. I'm not saying that's always the case, but that often is the case. So is there any context in which it's recommended that people pursue this or anything like that, or is it kind of agnostic?
There's one thing that we actually is in the terms and conditions that people need to do before using the app, and that is seeing their doctor or audiologist. The reason being is kind of a safety one more than anything. If you sort of suddenly develop tinnitus, there's a number of things that could be causing that. Some are reversible, like earwax or an infection. But there's also, in very rare cases, there's some more sinister things that could cause tinnitus as well, that it's important that you get checked. Once you've seen a doctor or audiologist, if your tinnitus is having an impact on your life, then Oto is suitable for you. And the things that you mentioned will often fit alongside those things as well.
Yeah. So, I mean, one of the things that when I was in the app that was great was you have all these different masking sounds. And so, it was almost like the litany of masking sounds I give to patients when I'm talking about masking. So can you talk a little bit about what that component is, or what those sounds are, and what the various ones that you kind of have offering to people?
Yeah, we have over 100 specially recorded sounds in the app. And the primary purpose of these is to be used as a background sound whilst they're listening to a audio session. So silence is actually people can use these how they want. People use them to help sleep. People use them to help concentrate. But we call them background sounds. Tinnitus, for people with tinnitus, silence can be particularly uncomfortable. There's a lot of silence in the audio sessions when you're breathing, when you're meditating, when you're doing a visualization, and when you're doing a thought exercise. And it's important for people to not have that silence filled by nothing. We want the silence to be a relaxing sound in the background to distract them from a tinnitus whilst they might be trying to focus on a CBT technique or something like that.
Yeah, I mean, it's definitely the case. And, the one that I liked was the ocean sound, but I know there are, that is one of the amazing things about all these digital devices. I mean, an app or a personal assistant, the Alexa or Apple Home, all of them, you can say, play ocean sounds, play, babbling brook, play wind noises. I mean, it's almost endless. And so it is true in my clinical experience that people have to kind of experiment and find. It's not going to be like, oh, you're a fan guy. I mean, it doesn't work that way. They have to really, because it is personal in terms of what they like, right?
Exactly.
I mean, if sound that's effective for a lot of people, but you say, gosh, I hate the sound of a box fan, then you're probably not going to be the person to use that sound.
We actually look at the data of the sounds that people listen to, and there's some really odd sounds in there. We didn't want to kind of restrict people on the sounds that they might be listening to. Some people will listen to, we've got one user that will listen to the sound of a motocross bike going around a track. Not a very nice sound at all, in my opinion anyway. But this user will listen to this sound for hours, to try and relax. So you're completely right. It is like a really, really personal experience, and what some people find useful and what some people enjoy is very different to what other people will. So it's important to experiment with the sounds that we have in there, which is why we've got so many, really.
Right. And so when you talk about some of the other stuff about the habituation, what are the other modules like? So how do they work? I'm just trying to give people an overview of like what those things be.
Yeah. So once you finish the core program, you can then go back to and practice some of the exercises or the exercises that you found most beneficial in that module. And these could be physics. So there's a physical therapy module with some neck stretches and jaw stretches that sort of develop on the techniques that we taught in the core program. There is a CBT module with some additional CBT exercises, or you can sort of practice the ones individually. There's a sleep module. There's a visualizations module. There's a mindfulness module. All these things that it's all evidence-based, by the way. All these things that have a base in evidence that have been shown to be beneficial in some way for managing tinnitus.
So do you do any sort of scale or measurement before, after, or people to assess their own tinnitus and measure the changes and things like that?
Yeah, we've done a small pilot study that found we did exactly that. We used something called the Tinnitus Functional Index, which is a questionnaire that assesses the impact of tinnitus on people's lives. We measured this at day 0 on a cohort of people, month 1 after using the app, and month 3. And we found that after 1 month, 86% of people felt better. And this was sustained at 3 months as well. And there was actually a statistically significant reduction in the TFI score at 3 months. The numbers were small, and we need to do things on a much bigger scale now to really, do a deep dive into how effective this is. But what I would say is that we already know that CBT is effective in tinnitus. That's been proven. We already actually know that digital CBT is effective as well. We just need to prove that, or certainly provide some more quantitative data to demonstrate that our way of delivering CBT is effective as well. But given the qualitative research that we have and the feedback and the testimonials and the reviews, I'm confident this will be the results will be positive.
A matter of time, right, for you to be able to.
Yeah.
Right.
Yeah.
And so do you have a particular demographic that tends to, by and large, apps tend to skew to a younger population? I mean, all things being equal, but are you seeing a particular age group that you're getting more adoption than others?
The majority of our paying users are between the ages of 40 and 60. Adoption of mobile apps is rapidly increasing in the certainly the older age groups. And what we're finding actually is that many of these users we're getting, this is the first app that people may have paid for, because they've searched on Google, some solution for tinnitus, and they found us. They wouldn't normally pay for app, but because of the positive sort of, the positive
experiences that are reported,
positive experiences of others that they've seen, they think, well, I want to try this out. So it'll be the first app that they might pay for.
Probably low risk too, right? So you've gone to the doctor, you have tinnitus, maybe I've had a discussion about these various things. And so the next step would be, a formal going to somebody and formally enrolling in cognitive behavioral therapy, which isn't everywhere. And that's a much higher threshold in terms of maybe not financial expense, but in terms of expenditure of time and effort and all of that. So this is kind of a mid-range entry point or something, right?
Yeah, exactly. You're completely right. CBT is notoriously, for tinnitus anyway, is notoriously difficult to access. Here in the UK, I've spoken to people that have been waiting for over a year on the waiting list for CBT in the NHS, and they only get 1 or 2 sessions, perhaps 3, 4 if they're lucky anyway. And in the US, there just aren't that many psychologists. It's difficult to find them, and if you can find them, they're really expensive, prohibitively expensive for many people. And that's not to say that the quality of the care they provide isn't good. It's of course it's good. It's just not accessible, and we want to solve that problem of accessibility.
It's a reflection of our reimbursement system. So, for the listeners, there's really 5 levels of a visit: level 1, 2, 3, 4, 5. And at some point, if you spend, let's say, by example, just on a time, not a complexity, 45 minutes with somebody, or you spend 8 hours with somebody, it can be no more than a level 5. And so some of these things that people need to tackle could be one session that takes several hours. So the typical reimbursement model in the United States just won't cover that. And so many of the providers have gone to a cash basis because they really can't survive. I mean, you can't pay your receptionist your rent and your malpractice spending 4 hours and getting reimbursed for a level 5 visit. It's just not financially viable. So a lot of them exist outside of the traditional reimbursement model. So this is kind of an entry thing. Does the app pass people on if they're not getting care, or if they're not getting care, if they're not getting results, or what happens in that respect?
No, we do have the option within the app to book an appointment, actually a free sort of intro appointment with an audiologist provided for by Treble Health. So Treble Health, you may have heard of, a company founded by Ben and Garrett Thompson, and they provide telemedicine and telehealth for audiology, and they'll provide support with tinnitus as well. So we do provide the option for people struggling, and we signpost them to Ben and to Garrett.
Access to care. It might be remote, it might be telehealth, but
exactly, yeah, if they do need extra help.
No, that's great. That's really and so I guess the other, I mean, if it's proprietary, I understand, but are there people who have short treatment courses on the app and then kind of get the relief, and then other people who kind of use it as a continual therapy? Is it one, both?
It's a mix, and it depends on what the users come for help with. If the users come for help with because they're in the very acute early stage of tinnitus and they're really struggling and they're anxious, then they may use the app for 4 or 5 months and feel better, and many of our users do feel a lot better after that time. If they're looking for sort of some help with sleeping or concentrating, and they've had tinnitus for a bit longer, then they may stay a bit longer, and they may continue to use it as as and when it's needed for help with sleep or concentrating or something like that.
Yeah, because I mean, ultimately, I think the measure of your success is payment. I mean, if people are willing to pay for the app, then it works, right? I mean, people, I think, as much as they're starting to learn how to adopt using apps, if streaming services are any example, people are very good at jumping off of it as well. And so I expect, I mean, for the listeners, there are people who do 1 month and jump from all the different streaming services because they want to watch all that content and then go to the next and then the next and the next. And so people are savvy enough to be able to do that. So retention of your users is probably the best indicator of the effectiveness of the application.
Absolutely. Yeah.
So what is it? So most companies that develop these things, they have what they would call their roadmap, what their future like. So what does the future hold for this app in terms of, what are you guys working on right now to a sneak peek of what'll be there in 6 to 12 months?
We're building a definitive digital solution for tinnitus. We want this to be the go-to solution for anyone with tinnitus, regardless of how severe it is. If you're having difficulties with tinnitus, we want Oto to be the place to go. So how do we get there? Well,
look at all the other competitors and see what they're doing, and hopefully either match or be better than them.
Yeah, well, we don't spend too much time looking at our competitors, and I'm very confident that Oto is the best digital solution out there. Okay. And what do I base that on? Well, the user research that we do, the qualitative feedback that we get, and the sort of the commercial traction that we've had as well. We're the only tinnitus app to receive institutional investment from venture capitalists, and we just closed the seed round as well, which we'll use to scale the company. But in answer to your original question, what's on the pipeline? Well, the exciting thing is I don't know, and we will determine that based on what our users' needs are. So we do a huge amount of user research, and we talk to our users every single week to better understand how we can improve the app for them. The end goal is the definitive solution and the best solution, the best digital way to manage tinnitus. But how we get there is kind of determined in the more short term by our users' needs and the problems that our users are having. If we kind of maybe zoom out a little, we're currently focusing on and doing our best to help people that are in the acute and early stages of tinnitus. That's what we're focusing on at the moment. And once we know we've done the best job we can at helping those types of people with tinnitus, we'll start to sort of expand the net slightly and start to help people that maybe have had tinnitus for a bit longer and are looking for help with sleep or something like that. So, we want to sort of cast the net wider and wider until we actually we are helping and we are providing that definitive solution for anyone that is having difficulties with tinnitus.
So it's not, I mean, obviously for some people it's dire, as you described in your clinical experience, but obviously there are other people who would love to help with it. And maybe they've just thought, well, and so the worst is always people are told, well, just live with it. Right.
Exactly.
And, that doesn't give people hope. And so even for chronic tinnitus people, so, I'm careful to say sufferers, right? Because as 25% of the population has tinnitus. So I'm not sure, for some people it's incredibly bothersome, and for other people it's just something they simply ignore. And so it is very individual and experiential.
Yeah, absolutely. And that's one of the sort of the challenges that we face, is that it is such a personal experience, and we need to make sure that the solution is firstly scalable, but also can be tailored to individuals' personal experiences.
Well, that's the beauty of it. If you offer so many tools, then people have to go in and they can experience all the different tools and then find the tools that help them. I assume that's kind of the model that you're going for, it sounds like.
Precisely. Yeah.
This is great stuff. That's great. And so just for the listeners, this is Dr. Edmund Farrar. He's a physician, and he works at Oto Health. He's a co-founder, and the app is Oto, and you can get it at the Apple application store or Google Play store. Is there any other way? I mean, not that there needs to be, but I assume those are the two most common ways. But
yeah, I mean, if you want to have a bit, you want to see a bit more information about the company, you can go to our website, which is joinoto.com, joinoto.com.
Okay, that'd be great. And if people wanted to get a hold of you, how would they do that?
Of course, yeah. So you can email me. My email address is ed@joinoto.com.
All right, well, that's simple enough. So
we're always looking to speak to people with lived experience of tinnitus, because we use that information to help us improve the app for future users. So if anyone wants to speak about their experience with tinnitus or the app, then please do get in touch. A member of our team would be very happy to speak to you.
That's great. And so one of the questions I love to ask people is, what's your favorite sound? I mean, we're both in the sound field, and no pun intended, but the field of sound. And so what is your favorite sound? I hope it's high-pitched hums like a cicada in your ear.
No, it's not. I don't get much help from that. I really like the kind of very orchestral, atmospheric musical sounds. We have a few of them in the app that our sound engineer has actually composed himself, and I just find them very relaxing and calming, and reassuring, and they do a great job of masking my tinnitus as well.
So do people stream that to a Bluetooth speaker, or I mean, hopefully, it's probably not healthy for the ear canals to keep earbuds or something like that in your ear all night. So I assume that's what they do.
Yeah, people do many things. People stream it to a speaker. People have Bluetooth pillows, tinnitus pillows that you can use. People have headbands with speakers in them. So there's a number of ways you can access these sounds.
That's great. And so, and the other question I love to ask people is, who are the people you would thank to, help you with this idea and get you here? It's always interesting to see who are the collaborators.
There's so many. Yeah, there's so many of them. I mean, the team we have really is amazing, and I'm so lucky to be working with people that are a lot cleverer and a lot more talented than I am. Start with my co-founder George. He's he's been amazing to work with. We've been friends for many years. It's awesome to share this experience with him. And my co-founder Jamil as well. Whose knowledge and experience of academia, but also tinnitus, has been invaluable. And then I think the sort of final member of the team that I'd highlight, everyone has been amazing, but the final members of the team that I'd highlight would be Anna, who's a hearing therapist whose decades of experience helping people with tinnitus have gone into this app. And it's, we wouldn't be anywhere without Anna. Anna is really, she's done such an amazing job of getting this experience down on paper and then providing help and advice for us to, provide the optimal experience for our users. And Lily is our content director. Lily's been with us from the early days. And
Lily, her voice.
It's Lily's voice that you hear. Lily works tirelessly to create this wonderful content for our users, and she does an amazing job of it. Just listen to the app; it's awesome. The rest of the Oto team, I would go through and thank everyone individually if I had time, but everyone else is I love working with them, and they work so hard to create this vision into reality. I'd also say thank you to our investors. We've got some really, really supportive, awesome investors. Many of whom have been with us from the early days. And then finally, our advisory team. We've got a really strong advisory team who are always on hand to help whenever we need.
That's great. So again, for everybody, it's Oto, O-T-O, and you can get it at the App Store for Apple or Google Play. And this is Dr. Edmund Farrar. He is the co-founder of Oto Health, the developer of Oto, which is a tinnitus management application. This has been a great conversation. I think it's really awesome for somebody to translate, medical, treatments into a application that people can access in the palm of their hand. It's a really great way to scale it and get it out to people. And I really look forward to seeing what happens with this app. Thanks so much for coming on the show.
Thank you for having me, Mark. Really appreciate it.
It's been great.
Thanks for tuning in to the Listen Up podcast. We'll see you again next time, and be sure to click subscribe to get updates on future episodes.